My name is Whitney Mann, and I am a public health program representative at Springfield-Greene County Health. So at the beginning of last year, I really decided to take a look at my health. I really just wanted to get healthy. So as part of that kind of journey to wellness, if you will, I upgraded my smartwatch. The first day I got my smartwatch, I was very intrigued by the fact that my heart rate was in the 40s pretty consistently. I was telling everyone about it because I could not believe how low it was, but I was very excited. I thought I was healthy, I'm running, I'm doing all the things right. And then about a week later, I woke up one morning to 8 notifications letting me know that my heart rate had gone under 40 beats per minute and into the 30s for a prolonged period over time. Unfortunately, the low heart rate notifications kept occurring overnight. It was just pretty much becoming a common occurrence. I was having them multiple times per week. And I decided that it was time for me to advocate for myself and talk to my doctor. She was very thorough immediately. She reassured me, yes, I am young. I'm only 27 years old and I'm running, but with matters of the heart, that's not something we want to take lightly. So she gave me a cardiac event monitor. On the 13th of 14 days wearing that monitor, I had a freak accident. My son busted open his eye and was bleeding everywhere. And in caring for him, as any mom would, I ended up passing out at the sight of his blood. About an hour later, I received a phone call that the doctor who was reviewing my cardiac event monitor had detected a significant event and that I needed to be evaluated at the ER immediately. When they put me in a room, that's when we learned that I had experienced a 9.1 second sinus arrest. So my heart had stopped for 9.1 seconds. When they initially told me this, I did not think it was serious at all, because when you're looking at a heart strip, I thought 9 seconds isn't that long. So I'm probably gonna go home later this afternoon, and quickly learned that 9.1 seconds is extremely significant, and I was admitted to the hospital. So this isn't normal. So when you're talking about a high heart rate, there are medications that you can take to try to treat that in order to bring it down. But when you're talking about low heart rate or your heart actually stopping, there's not medication for that. And so you need to have a pacemaker essentially on standby if needed to kick-start your heart back. So the next morning, I, at 27 years old, received a dual chamber pacemaker, which means I have a device implanted underneath my skin and 2 lead wires that go into my heart, constantly monitoring the activity. And if I go below a certain threshold, it kicks in so that my heart will continue beating. I was given a diagnosis of sick sinus syndrome, which essentially means that your heart's electrical function and beats aren't working the way that they should. So for me, my heart rate was beating very slowly, and there was a disconnect with the electrical function there. When I passed out, I experienced something called vasovagal syncope. Essentially, this is passing out to a trigger, such as the sight of blood. Most people just have their blood pressure drop and they pass out, and when they lie flat, the blood is able to rush back to their body and they come to, except for with me, when I passed out, my heart stopped, and that was not normal. We only have one body. I have this one body that I have to care for, and I have to nurture, if you will, in a way to ensure it's taking me to tomorrow. I have 2 small boys who depend on me. And so getting the pacemaker really put that into perspective as well, because I wasn't able to care for them for about 8 weeks as the leads in my heart were healing. And so I just really want to take every moment at face value and appreciate it, because you literally never know when that could be taken from you. And it was so close to being something like that for me, and I'm very thankful that it wasn't.